Right, for COVID-19 cases in the Philippines now breaching 3.2 million. For more on the current surge, we're now joined by Dr. Rontgene Solante. He's chief of the Adult Infectious Diseases and Tropical Medicine Unit at the San Lazaro Hospital in Manila. Dr. Solante, nice to see you again. Thanks for joining us today.
Hi, Carmina. Good afternoon.
Good afternoon to you. So let me ask you, how would you describe the current situation that we're in right now?
Well, you know that cases are still increasing here in the ground. We're seeing a lot of this mild to moderate COVID. The difference here is that compared with Delta, in the Delta, we're seeing a lot of those patients needing oxygen. This time, we're not much of the oxygen, but they're just complaining of body malaise, myalgia, cough, and I think that's more of the most common manifestations. And because of their comorbidities, most of them are going to the hospital just because to check on their comorbidities. If it's not because of their comorbidities, majority of times it's really not because of COVID, but because of their comorbidities.
I got it. And they're sort of also concerned because even if they're vaccinated, because they have underlying conditions, they don't know where this infection is going to bring them. So better, to their mind, it's better to be under the care of doctors.
Yes. The scenario now is that you don't know where's the source or what's the source of this infection. Mm-hmm. Most in the household are positive, mildly symptomatic. But again, we always have to remind everyone, no? It can be mild, but for the vulnerable population, for the 60 years old and above, those with comorbidities, these are the people that may have unstable comorbidities when COVID infection sets in.
Dr. Solante, lots of people coming out of their quarantine now as we speak, but they're still testing positive when they use RT-PCR tests. Why is this so? And until when will they be contagious?
Okay, and let's remember this now. When one is infected and when you have the symptoms, when you have only mild symptoms, the most you can do is you have to isolate yourself. If you are fully vaccinated, the most that you are still infected within 7 days. And after that, you can go out of your isolation. If you are not fully vaccinated, then you need to be quarantined at least 14 days now. So the 10 to 14 days is the golden period by which you still have to be maintained on isolation if you are symptomatic. And as much as possible, even with an RT-PCR positive, but you are already beyond the 10 to 14 days, then most likely you are not anymore infectious, but they're still carrying the virus, which is remnant of that during the first few days of active infection.
So what then should you use? Do you use the days or do you use antigen tests to determine if you're still positive or negative, considering that, as you said, the RT-PCR test may still read the remnants of the virus? Go ahead.
Yeah, that's a good question because a lot still doesn't know how to interpret how many days that they need to be isolated. When you say isolation, meaning you have the symptoms. If you only have mild symptoms, you need to be isolated for 10 days. Okay, the most is 14 days if you still have symptoms. But remember, beyond those days, even if you're an RT-PCR positive, chances of you being able to transmit is already less. And that's what we want, that you have to isolate those particular critical number of days. So don't be worried if you're, and that's why, Carmina, we don't use RT-PCR again, no? That you need to repeat it again after 10 or 14 days because a lot of times that will still be positive, but that virus is not anymore transmissible.
Yeah. So the key here is isolation and, cutting the transmissibility of, cutting the transmission of the virus to other people. What do you think of the situation now, Dr. Solante? Do you think that we are nearing the peak?
Most likely, the data that will be gathered in the next 4 to 5 days will be very crucial because if it will still be increasing, then that will be nearing the peak. But if it's already downtrending, then that most likely we are already beyond the peak.
Finally, you're an infectious diseases expert. With the way this Omicron variant is behaving, do you think that we are nearing the end of this pandemic? We've been hearing a lot of things about this. Some COVID minimizers even calling this Omicron variant a blessing, but I want to know what you think, Dr. Solante.
Well, this is the heavily mutated virus that we have seen so far. And the other aspect here is that it presents with less severe symptoms. Now, if you are infected with this, that means you have the antibody, okay? You can be protected with a reinfection. But again, a reinfection is not remote, again, with another Omicron variant, because, when you had an infection and you don't have the vaccine, then reinfection can set in within 30 days, within 40 days. That's how early, because that reinfection is always possible. There's no such thing as lifelong immunity against any infection. If it will be the end of the pandemic, it will be the end of an Omicron variant, but we don't know what other variant will emerge, and that we have to know. So meaning I'm not so I'm not so optimistic about that this will be the end of the pandemic. As long as, Carmina, remember, as long as there will be community transmission of COVID-19, there will always be a possibility that mutation can occur and a new variant of concern can emerge.
And finally, Dr. Solante, we're handling it pretty well, I would say. If you compare it to the other surges, our hospital utilization rate, but of course the manpower suffered greatly. I want to know what kind of warning you can give to the provinces, considering that what we're experiencing right now may just be what they're going to experience in the next few weeks.
Well, it's very important, again, to remind them of the health protocol, because the way we had this Omicron variant-driven transmission in Metro Manila, it's because of the gathering during the holidays. It's because of less compliance to the health protocol. These are very important aspects in the prevention of blocking that transmission. And of course, we need to, again, encourage everyone, especially in the provinces where the vaccination rate may not be as high as that with the NCR. Vaccination is important. Get your booster the soonest possible time. You are a candidate for that, because that will be your difference in terms of getting the more severe and getting the mild symptoms, which is vaccination.
Dr. Rontgene Solante, infectious diseases expert there at the San Lazaro Hospital. Thanks for all that you do. Thanks for making time for us this afternoon. Really appreciate it. Take care and you keep safe.
Stay safe.